Hello, everyone, and welcome to Health.Europe.You, the official podcast of the European Medical Students Association. My name is Alexandra, and I'm EMSA's Vice President of External Affairs. And together with my lovely colleague Ogul, our Secretary General, we are in this episode titled Health.Europe.EMSA, going to talk about EMSA as an organization, how we are set up, and what it is that we exactly do. So before we go into these specific questions, there's one overarching broad question that we have to ask ourselves. So, can you maybe explain what is EMSA?
Okay, that question seems very broad, but it can be dwindled down into the specifics. So we are, in the basics, a non-governmental organization that is based in Brussels, and we're representing medical students from across Europe. And when we talk about the organization, we have to talk about the members. So our members, opposed to other student organizations, are not organized as national sections, but they are organized by each faculty representing itself. We call them faculty member organizations, or FMOs for short. Additionally, there's also the opportunity to be an individual member in our association, which specifically becomes relevant when there's no faculty member organization or FMO where you study. Our NGO currently is made up of 112 faculty member organizations from 29 European countries as recognized by the Council of Europe. And in order to do the representation that we mentioned of the medical students from Europe properly, external work plays a vital role. And as the Vice President of External Affairs, Alexandra, can you describe how that works a little bit?
Sure. So that's actually very common that we within the Department of External Affairs get asked by members as well. So the external partnership network of EMSA can basically be subdivided into three broad sections or categories. So firstly, we have the student organizations with whom we work. And then secondly, we have the stakeholder organizations. And thirdly, we have non-stakeholder partners. So firstly, speaking about student organizations, as we are a student organization ourselves, we are also collaborating with other healthcare students associations as part of different networking groups. EMSA as an organization is a strong advocate for interprofessionalism, and we try to encourage that for our members as well as at a very early stage, which is basically why we are so happy to be working together with our fellow healthcare students associations from across Europe and also internationally. Secondly, we're collaborating with stakeholders. So just to mention a few important ones, EMSA as an organization is collaborating with the WHO, so the World Health Organization, EMSA being an accredited non-state actor. Other major partners include, for example, the CPME, or the Standing Committee of European Doctors, and also EMS, which is the European Union of Medical Specialists. While talking about stakeholder organizations, it also has to be mentioned that EMSA as an organization is the only organization representing students as part of the European Medical Organizations, or EMOs for short. Now, the EMOs are basically a network of various professional organizations within Europe, various medical organizations within Europe. So, for example, also the CPME and EMS, and for example, also the European Junior Doctors, or EJD for short, who are also a member of that networking group. And as I said, EMSA is it's the only organization representing students within that group, which is an incredible opportunity for us. Apart from these three major groups, EMSA is also part of various European Commission projects, as for example, the Coalition for Vaccination or the EU Joint Action for Vaccination, and many more. In any kind of external work we do, and in collaboration with all the external partners that we have, we always try to basically bring the opinion of medical students from across Europe to the table and to discussions and to further basically issues that are close to our hearts and discuss them. But overarching to all of that, and the basis of all of that, are our vision and our mission of EMSA as an organization, and that is very, very important. So, what exactly are those?
So like you said, Alexandra, they describe what we want to do, what we want to achieve when we're doing these external work, or also our internal work. We have them listed in our IRs, or we call them IRs, the internal rules that we have, like a rule book, basically, that we have. And I'm going to quote them from our internal rules specifically, because in our opinion, that really describes everything in a very concise way. In our vision, it says, EMSA envisions a united and solidary Europe in which medical students actively promote health. And in our mission statement, it says, EMSA empowers medical students to advocate health in all policies, excellence in medical research, interprofessional healthcare education, and the protection of human rights across Europe. We are committed to ensuring the highest standards of healthcare and medical education in a united Europe where medicine is practiced in accordance with the highest ethical principles. So when we look at the mission and vision statements, we see how we see what we want to do, and we see also our working areas, or we call them pillars, which we're going to mention really soon in this episode, actually, a little bit. We see medical science, we see human rights and ethics, we see medical education, so on and so forth. But it doesn't really describe what we do and how we achieve these goals. So, Alexandra, can you describe what we do generally?
Sure. So, basically, in order to achieve all of these goals, we have various kind of ways to go about that. Firstly, we start by connecting medical students from across Europe, primarily also with each other through, for example, twinning projects, or also any kind of other projects within our organization to, on one hand, exchange viewpoints, broaden everybody's horizons, and just give opportunities for intercultural collaboration as well. So that's very much one of the core things that we do. Secondly, we, as I was saying, are also trying to make the voices of medical students from across Europe heard. So we're trying to get issues that are important to our members and our faculty member organizations on the map, also with European and international, or with international, but specifically European stakeholder organizations, or on the European level in general. So to do that, or within doing that, we basically advocate for solutions to problems regarding, for example, medical education, or also things that are important to us regarding public health or human rights, medical ethics and human rights, or European integration and culture, health policy, medical science. Well, anything basically that is part of our working groups, or also that just comes up within our memberships where our members think we should comment on that or take a stance as European medical students. We do all of that work basically under the umbrella of our motto, which is Health.Europe.Together. And if you look at that closely, you can maybe see that our motto, Health.Europe.Together, also reflects in our podcast title, Health.Europe.You, which is a little side note that I just wanted to mention here. We try to achieve all of these goals, or we try to do our work, as I was saying, primarily also through working with external partners, and collaborating on projects with external partners in order to bring the opinions of our members to the table in communications with stakeholders. What's also very, very important for that, though, is our internal work, which we will get to in the episodes to come as well, by the way. So the external department kind of can't work without the internal department, and vice versa. EMSA can't really be seen, even though, we are subdivided into various sections. We work as a whole. We do all of our work not only to represent the opinion of medical students, but also to supply a platform for our membership and for our members, for example, for peer educational purposes through, for example, twinnings or sessions being held, or workshops at our assemblies, but also now, especially in COVID times that we are in right now while recording this episode, or also generally in the new digital era, we try to do that as much as possible in the online format as well, so that as many people as possible can take part in our events and learn from these opportunities as well. Now, as I was saying, the external department relies on the internal department. I've been kind of dropping the word department a lot, I feel like. So you may be asking yourself what exactly a department is, which is a very good question, which brings us to the next aspect, which basically is the setup of EMSA as an organization. So, how exactly do we work? In which formats do we work? What are departments?
Mm-hmm. So, as many organizations do, EMSA also works as a board. We call it the EMSA European Board. And this board is subdivided into two sections, one of which is the executive board. And the executive board has 6 members, and they are the president, the secretary general, which is myself, the vice president of external affairs, which is Alexandra right here, also the vice president of internal affairs, the vice president of capacity, and the treasurer. And the other section that we have is the officials board, which is the department members. as Alexandra mentioned, we have some departments, and we're going to go through them one by one and describe their members. And those members would be the part of the officials board. So our departments are, the first one is the Department of External Affairs. This department does all of our external work, our representation when it comes to external, for example, the external partners or stakeholders, as Alexa mentioned. And this department is managed by our Vice President of External Affairs, Alexandra, right here. The other department that we have is the Department of Internal Affairs. This department does our internal work, our internal projects, governs them, helps with the projects that we create. Well, not help, but actually create them and go through with them. This department is managed by our VPI, our Vice President of Internal Affairs, and the other members are what we call our pillar directors. And as I mentioned before, the pillar directors, the pillars actually are our working areas that we focus on, basically. We have 6 of them, and they are medical education, medical science, public health, medical ethics and human rights, European integration and culture, and health policy. Like I said, all these pillars have their specific directors, and they work within the Department of Internal Affairs. And another department that we have is the Department of Capacity. And I mean, Alexandra, what don't they do? They deal with our public relations, they deal with our events, they manage our publications, specifically the main magazine that we have, Euromed's magazine. They also deal with our training system, and as Alexandra mentioned before, we use it for peer educational purposes.
They also help us with this amazing podcast. So honestly, the question honestly is, what don't they do?
What don't they do, really? Another department that we have is the Department of Finance. Oh, by the way, that department is managed by our VPC, our Vice President of Capacity. Moving on with the other department that we have, which is the Department of Finances. This department is managed by our treasurer, and they do financial work for EMSA. So they manage any financial stuff that we have. They manage the membership fees. They manage everything that relates to finances, basically. We also have another group that's working, which is not a department, but a small team that we have, which is the secretary team, which is managed by myself, the Secretary General. They do a lot of paperwork for EMSA. They also connect our EEB, our European board, with our members. And they convey the message of the European board to the members. They also convey the message of the members to the European board. Now we have our European board, we have the EEB, but we also have other officers that we have. Alexandra, can you mention what kind of officers that we have outside the EEB?
Yeah, definitely. For the secretary team, though, you shouldn't sell you guys' work short. Because, for example, if anybody wants to be a member of EMSA, you are the ones who kind of process that, which is a major amount of work as well. So
that's true. When you're in it, you kind of forget about what you do.
I know.
So I think that affected my perception.
I mean, it's the same for me. I think it's the same for everybody. Once you're used to the amount of work, it's like, yeah, I'm just doing it. And then, for example, you write like a report about what you've done in the past 3 months, and you're like, oh.
Yeah, that's true.
It's still a lot of fun.
It is.
Yeah, but onto the other officials that you didn't yet mention.
Mm-hmm.
So one major group as well, which has to be mentioned, is our supervisory council, or SUBCO for short. And we kind of like to describe them as our guardian angels, which is a term that our former VPI has introduced. So the SUBCO kind of looks over what we do. On one hand, also right now, a lot of, how we're doing with stressful situations, or if everything's okay. But secondly, also to kind of check if what we do is quote unquote legal, let's say. I'm putting this in air quotes. And in accordance with our IRs, so our internal rules and our rule book, basically. So we have these rules just to kind of guide us on how exactly our organization functions and how to do things. And we have to abide by them. And our SUBCO obviously always checks kind of if we're on track with that in accordance with them. In addition to that, we also have our supporting officials. So, for example, the Euromed's chief editor, as you mentioned, the Euromeds is our main magazine, so our main publication as EMSA as an organization. And the chief editor of that magazine is one of the supporting officials. We also have our medical education liaisons officer, so Milo for short, which is basically a person part of my department, so part of the external affairs department, but specifically in charge of the medical education's pillars external affairs. And last but not least, we also have our PO positions, or permanent officer positions, so to speak. They're also part of the external affairs of the Department of External Affairs, and we have 2 permanent officer positions, which are basically internship positions with our external partners. And I'm very excited for those, and I'm very excited for you to discover more about those, because they're amazing opportunities of 6-month-long internships with our stakeholder partners, or with some of our stakeholder partners in Brussels. Now, this was a lot of input, I feel like, so I really am sorry if this was too much, but this should have given you a little bit of an overview. And this kind of lays the groundwork for all the future episodes to come. So in the next episodes to come, we're going to discuss, or we're going to go a little bit deeper into each department that we've spoken about, which is also where specifically I will get the opportunity to tell you more about the PO positions that I'm so excited about. However, in the next episode to come, I will be talking again with the lovely Secretary General Ogul about the secretary team, because he has sold the team's duties a little bit short. And we're just going to go a little bit into what exactly they do, and also how it works with the membership statuses, how you can become an individual member, how you can form your own FMO, and what kind of steps that includes. So stay tuned for that. We're very excited to bring all that information to you in this new kind of format that we're using. In the meantime, if you have any questions that you would like us to answer, please use the hashtag AskEMSA. That is hashtag AskEMSA with a capital A and capital EMSA, so capital EMSA, on all social media platforms, to ask us any questions that you want us to cover in the podcast episodes to come, and we'll then implement them wherever they're suitable. So we're very excited to talk to you guys through that medium, and for you to get a little bit more insight into what it is that we as an organization do, and also in the future, then maybe some projects that we have coming up, and maybe we can even talk to some external partners. And until then, we hope that you all stay healthy and hope to hear from you soon. Bye-bye.
Bye-bye.